Hey, would you give me some cheesy puffs? Is this thing on? It is? Okay. Welcome to a Gobbet 26 from October 6th, 2008. I don't know. Call weekends, which was this weekend, are long. I cover 2 states and 8 hospitals, and I get to see great cases, but I'm glad I can come back to my mere 3 hospitals. I think my nickname should be peripatetic. ID consults generally fall into 2 categories. 1, how long do you treat an already defined infection? 2, what the heck is this germ and what do I do with it? And 3, what the hell does this patient have? I enjoy type 3 the best. They are the most fun and offer the greatest opportunity to use those 3 words that increasingly define my practice. I don't know. House seems to figure out each case in about an hour, although the route by which he gets to the denouement almost always gives me conniption fits. And as I always say, if the conniption fits, wear it. It's why I do not watch medical shows. They seem to always get it wrong. Except, I suppose, for Scrubs, which is closer to reality, at least my reality, than the other medical television show. Every year, I know more and more. I read about 1,200 articles a year. I attend conferences, and each year I seem increasingly unsure about what is going on with my patients. In the skeptical world, they talk about the arrogance of ignorance. See Jenny McCarthy as a good example, where people who know the least on a topic feel the most knowledgeable. I have the opposite problem. The more I know, the less confident I become. But then that's the definition of a specialist, somebody who knows more and more about less and less until he knows everything about nothing. So much of the time, I can't figure out what my patient has, but they get better, and I make sure I get all the credit. If things go badly, of course, I blame nursing. It is a curious phenomenon that knowledge breeds uncertainty. However, part of being a specialist is to be ignorant with panache. I have buckets of panache. And I tell patients that as long as they are getting better, it's probably a good thing I cannot make a diagnosis, because in medicine, we are very good at diagnosing diseases that will kill or injure you, but no good at diagnosing the trivial, self-limited illnesses that are life-inconveniencing, but not life-threatening. So most of the time, no diagnosis is a good diagnosis. Problem is, when it comes to billing, I need a diagnosis and a diagnosis code. Now, you can tell a doctor by the code she knows by heart. Here are some of mine. Staph aureus bacteremia, 038.11. Fever, my favorite, 780.6. Urinary tract infection, 595. And that perennial favorite, endocarditis, 421. There are codes for everything, every disease. There is a code for being electrocuted in a bathtub. Now, they tell whether or not it's a toaster or a hairdryer. There's a code for being sucked into a jet engine. There's even a code for weightlessness. I suppose this comes from NASA, but I'm really looking forward to the first patient to present with that complaint. So, what can I do for you? Doc, I'm weightless. What I really need, and the one thing for which there is no code, is the diagnosis. I don't know. Or maybe I just don't know it. See you next time for another Gobbet Opus. And send me a bag of cheesy puffs.